Hi, I'm Rachel Van Cali. I'll be your genetic counselor today.
Nice to meet you.
You too. Take a seat. So, what brings you in today?
So I believe my 6-year-old son Tom may have neurofibromatosis. Our primary care physician referred us to you for further evaluation.
What are some of Tom's symptoms?
He has multiple cafe au lait marks on his skin.
About how many?
I'd say 7 or 8.
Okay. So, anything else?
He has freckles in his armpit area and bumps under his skin.
So next time Tom comes in, I'm going to measure his head size because an indicator for NF1 is a larger than average head circumference. So have you noticed any learning disabilities?
Yes, actually, he has trouble keeping up in school.
Okay, that also makes sense. So that correlates with NF1. How about I tell you about some of the different types of NF?
Okay.
Types of neurofibromatosis. The first type is known as NF1 and can also be called von Recklinghausen's disease. It is the most common form of the disease and occurs in 1 in 3,000 to 4,000 people. To diagnose NF1, a specialist would check for at least 2 of the following symptoms. At least 5 cafe au lait spots, which are large, coffee-colored spots on the skin that resemble birthmarks. They could also check for 2 or more neurofibromas or 1 plexiform neurofibroma, which is simply a neurofibroma that involves many nerves. They could check for freckling of the armpit or groin, leash nodules, which are growths on the iris of the eye, optic nerve tumors, or bone deformities such as scoliosis. Individuals with NF1 also tend to have a larger head circumference and are shorter in height. The first symptoms usually noticed in a patient with NF1 are skin symptoms that show up shortly after birth, and they are almost always present by the age of 10. NF1 is a progressive disorder, which means that the symptoms get worse over time. Here are some examples of the symptoms of the first form of neurofibromatosis. The second type of neurofibromatosis is known as NF2 and is also known as the bilateral acoustic form of the disease. It is the rarer form and occurs in 1 in 25,000 people. NF2 is characterized by tumors on the 8th cranial nerves, and these nerves are then broken into vestibular and acoustic branches. The vestibular branches usually deal with balance, and the acoustic branches deal with hearing, so tumors on these nerves often cause balance and auditory problems. The tumors of NF2 are called vestibular schwannomas, as opposed to the neurofibromas of NF1, and this is due to location and type of cells involved. For NF2, there are rarely cafe au lait spots on the patient, which makes it somewhat harder to diagnose than NF1. Plus, because the symptoms of NF2 are subtle and the disease is progressive, patients are not usually diagnosed until early adulthood, around the age of 18 to 22. The third type of neurofibromatosis is known as schwannomatosis. This is the rarest form of the disease and makes up only 15% of all cases. Schwannomatosis is characterized by multiple schwannomas everywhere except the vestibular nerve, which is how it is different than NF2. There are also no neurofibromas, which is how it is distinct from NF1. The main factor noticed in schwannomatosis is pain, which ranges between moderate to intense depending on the individual. Certain individuals experience such mild pain that they go undiagnosed their entire life, whereas other individuals have such severe pain that it is hard for them to accomplish daily functions.
So now that we have gone through some of the types of neurofibromatosis, it would appear that Tom has symptoms of NF1, but we have to perform some tests to make sure.
What kind of tests?
Well, we start off with a physical examination, and then we can move on to a CT scan, X-ray, MRI. We can do some blood tests or even a biopsy of one of those bumps under his skin that you mentioned. Those are called neurofibromas.
Is that all?
We would also like to do a pedigree or family history unless it appears to be a spontaneous mutation. So does anyone in your family have NF?
My husband appears to have NF.
Okay, so how about I tell you about how the trait is passed down?
How is the trait passed down? Neurofibromatosis can be an inherited disorder or the product of a spontaneous gene mutation. It is caused by 2 separate abnormal genes and is considered to be an autosomal dominant disorder. The gene for NF1 is located on chromosome 17, while NF2 is located on chromosome 22. Children will have a 50% chance of inheriting the genes that cause NF if the parent has NF themselves. The type of NF the child inherits will be the same as that of the parent, but it may differ in severity and appearance of symptoms. Unlike most other autosomal dominant conditions in which one altered copy of the gene is sufficient to cause the disorder, 2 copies of the NF1 gene must be altered to trigger tumor formation in NF1.
A mutation in the second copy of the NF1 gene occurs during a person's lifetime in specialized cells surrounding nerves. Almost everyone with NF1 acquires this second mutation. Let's take a deeper look at this mutation. The NF1 gene product is a protein called neurofibromin that turns off a proto-oncogene called RAS. The function of RAS is to stimulate cell growth and division. When not regulated, RAS can allow tumor formation due to cells growing and dividing too rapidly. The rapid growth and division of cells leads to the formation of neurofibromas, which are benign tumors. A similar occurrence happens in NF2. The NF2 gene encodes a tumor suppressor protein called myelin. Myelin interacts and inhibits multiple cellular pathways, leading to the clinical manifestation seen in NF2.
So if Tom is confirmed to have neurofibromatosis, what are possible risk factors?
Well, for NF1, some of those factors would include cardiovascular problems, neurological problems. It's possible for those neurofibromas to become cancerous. It can also have visual difficulties or skeletal problems. For NF2, those risk factors would include brain and spinal tumors, cataracts, partial or total deafness, and skin lesions. And then schwannomatosis, the risk factor is usually just debilitating pain.
Are there any treatment options we can pursue?
Well, the most recommended approach is to monitor Tom for tumor growth and for signs of pain or weakness. Down the road, you could potentially remove those tumors if they start to cause cosmetic problems, if they start to put pressure on organs, or if they're in an inconvenient area.
And would they come back?
There is always that possibility, and sometimes the tumors are woven in between the nerve structures, so it makes them hard to remove.
Okay, and what if the tumors are malignant?
Well, if he does have any malignant tumors, they can be treated with standard cancer therapies such as chemotherapy and radiation therapy.
Okay, and what is the outlook for a person with NF?
So, for people with NF1, the symptoms are usually mild, and the patient can expect to live a normal life expectancy and have a full and productive life. For NF2, the outlook usually depends on the age of onset of the disease and then also the size and location of the tumors.
And is there any research being done?
Absolutely.
We interviewed Dr. Jacqueline Peacock, a research scientist at the Laboratory of Musculoskeletal Oncology at the Van Andel Institute in Grand Rapids, Michigan. What type of neurofibromatosis research is currently being done at Van Andel Institute?
Right now, several projects are underway. One focuses on developing a model of malignant peripheral nerve sheath tumors, which affects about 10% of people with NF1 and are very aggressive, that we use for preclinical studies using new combinations of existing chemotherapeutic drugs. Once preclinical studies are successful, we hope to be able to organize clinical human studies. Another project involves a deep analysis of one individual's tumors. In this case, a person with NF1 donated tissue from a tumor before and after treatment, and again at recurrence. We are comparing the DNA sequence, copy number of each gene, and mutation in them, and methylation, accessibility of genes to transcription, in the tumor samples, in his blood DNA, which we consider germline, and in his mother's DNA. A third project that has just begun includes assembling a large database of cutaneous neurofibromas, along with life history information in order to do genetic analysis on the different cutaneous neurofibromas a person might have and what types of second hit mutation cause them. It's thought that the single affected NF1 gene that people with NF1 are born with is not enough to cause tumors to form, and generally the second copy of NF1 in a given cell must be mutated somatically for abnormal growth to occur.
In your lab, do you mostly research NF1, NF2, or schwannomatosis?
Our current projects focus on NF1.
Are you focused on symptom relief or an actual cure?
It is difficult to define what a cure for NF1 would be. People often think of gene therapy, but in NF1, it's not the lack of function in the tissue worth of cells that's a problem. Usually a second hit mutation in a single cell causes a tumor to form. This means that for gene therapy to be effective, we couldn't just correct the NF1 gene in some cells to have an effect. I would think about this in contrast to cystic fibrosis, for example, where even a few cells with better working transporters could improve lung function. NF1 would have to be corrected in every cell, which just isn't possible. We are focused on effective strategies to prevent or slow tumor growth, and better therapy to treat malignant tumors once they arise.
Is your work primarily in the lab, or is it involving contact with NF patients?
I only work in the lab, but I've been very fortunate to be able to meet NF patients and advocates through NF Michigan and the Children's Tumor Foundation. It's very important that all the samples that are donated to the lab are not identifiable as individuals for patient and family privacy, so we have a de-identification system in place.
Has awareness for NF changed over time?
Most people, even many scientists, are not aware of NF. I'm not sure why this is, because it is one of the most commonly inherited genetic disorders, similar in incidence to Huntington's disease or cystic fibrosis. Recent advances in genetics have helped us to better differentiate NF1, NF2, and Legius syndrome, which is good for people who may have previously been misdiagnosed and not have the best information about their future health. I'm not involved in these, but I know that coordinated care at NF clinics, like the one here in Grand Rapids, where geneticists, surgeons, pediatricians, and neurologists work together, are a valuable tool in caring for the different concerns someone with NF might have.
So it's been a pleasure meeting with you. I hope you found this appointment helpful. If you have any further questions, please feel free to contact me. I look forward to meeting Tom.
Thanks for all your help.
No problem. Have a nice day.
You too.